Welcome to everybody. We are letting folks into the meeting and we'll get going in just a moment or two.
Oh, nice, Pat. Is that too much green? I mean, am I overdoing it?
Jane, it's awesome.
I thought about doing the same thing.
And then I just heard what I was exclaiming about is that taxes have been delayed to May.
Awesome.
So that's cool.
Okay, well, we've got 4 o'clock on the nose, so we've got a bunch of people here with us. So I think we'll kick it off and get it started. Welcome, everybody. My name is Margie Beaudry. On behalf of Trust for America's Health, I'm very pleased to welcome you to the end of our second week. Sorry, we're in our 3rd week of Huddle calls to discuss challenges and solutions for ensuring access to at-home COVID-19 vaccines for older adults and people with disabilities. This session is being recorded so that we can capture all of the ideas and experiences shared. So I wanted to note and acknowledge that this call series is a part of an initiative to identify and foster adoption of innovative and promising practices on this topic. And this work is made possible through the generous support of the John A. Hartford Foundation, which works tirelessly to improve care for older adults, and the Cambia Health Foundation, which is dedicated to improving the way people experience health care. Can I ask those on the call to please mute yourself so that we can hear on the recording especially. So access to the COVID-19 vaccine for older adults is being prioritized across the country due to the vulnerability to more serious illness from the virus among this population. However, for the estimated 15 million older adults and individuals with disabilities who do not leave their homes, access is challenging or impossible. These challenges are not well understood, but government agencies are beginning to attend to these challenges as the vaccine supply increases. Many jurisdictions are still challenged in identifying who needs a vaccine administered in the home, and state and local governments must compile lists from multiple sources. And there are additional complexities, the increased number of certified vaccinators and variations in stabilizing the supply of 3 different vaccines that may be used for home visits. Vaccinating this population is even more challenging because of a crazy quilt of definitions, vaccination policies, and reimbursement difficulties, as well as workforce needs, not to mention cultural and language barriers that must be overcome to vaccinate this population. But state and local health departments across the country, working in partnership with the Aging Network, hospital systems, and other community partners, are turning their attention to this population, and a variety of innovative and practical solutions are emerging. Throughout this call, please use the chat function to share challenges, lessons being learned, and opportunities to improve vaccine access. In studying this topic, we are seeing some themes emerge. Over the course of our call series, we expect to touch on each of these themes from various perspectives. We're all learning together at this critical moment in time. These huddle calls are designed to share just-in-time or just learned information as broadly as possible. Today's discussion is focused on the work and perspective of visiting nurses. I'm very pleased to welcome Steve Landers. He will share observations and insights about the current state of practice in delivering vaccines in the home, after which we will open it up for discussion about your experiences and how this plays out across the country. And Steve, I'll turn it over to you.
Thanks so much, and thank you for all the efforts here. Real quick, by background, I'm a family doctor and geriatric medicine doc, and I do home care as my clinical work. And then I'm responsible for a visiting nurse organization, and we have several programs, a Medicare certified home agency. We're one of America's 11,200 home health agencies, a hospice agency, a home visiting medical practice for home-based primary care medical group, and then a public health agency as well, where we provide other types of home and community-based public health. And on any given day, my colleagues and I, we have about 10,000 homebound people under our care. And so from our perspective, our problem has not been finding the homebound. We've actually got 10,000 who we're responsible for doing a good job taking care of. And we know we've surveyed them. Their median age is 86. 76% of them have not yet received a vaccine, and over 80% of them want one. And so we've got this, my team and I, we have this deep sense of responsibility and also, quite frankly, frustration, because we very much want to make sure these people that we care so much about get the access to the life-saving COVID-19 vaccine. And so we've been trying to find dance partners, and there are like entities like ours all throughout the country that are easily identifiable through Medicare provider databases, trade groups, and other. So we're not that hard to find, and probably Medicare home health agencies on a day like today will do about 900,000 home visits across the country and care for a daily census of about 3 million homebound people. And they're not all that hard to find. So we've got to find a way to get these folks vaccines. I'm going to share with you a quick video of a pilot that we're doing to try and make some progress on this topic. I'm not going to show the whole thing, but I'm just get it going.
Steve, we're not getting the sound.
Oh, really?
Yeah, I think it's probably coming through your computer speakers.
Oh, so does that mean it doesn't, that means I probably can't do it then? Does that sound right?
I'm trying to figure out. I thought
No, you should be able to when you're sharing your screen. If you unshare your screen and then try to share it again, in the bottom left, you should see a more option.
Yes.
And it should say optimize for video. Click that button. It should be in like the bottom left, if I'm correct. Or share sound or optimize for video clip. Those two buttons, those two checkpoints.
Mine.
Do you see that? So when you click the green button that says share screen,
Yeah.
bottom left corner.
Advanced sharing options.
Say that again.
It offers me advanced sharing options. It doesn't offer me to what you're suggesting.
Okay.
you wanted to-
Close that window one more time and then reopen it up. Should be pretty...
Yeah, I mean, it's meaning close. I have nothing open.
So here's a suggestion, Steve. Can you just take the link and paste it into the chat, and then we can have Langston show the video.
Oh, that'd be great.
Yeah,
Thank
if you can just paste the link into the chat, then we can not hold everybody up with it, and
Yeah,
we
and
can still see
we
it.
can do this for 1 second here, and if not, then we can move on. I can certainly make progress in the discussion without this. I just wanted to show you the picture of what our nurse is doing and what we've learned.
Yeah. So there it is, Langston, if you want to try and show it.
Just 1 second. It's loading up now.
Nearly 25 years ago, lawmakers passed comprehensive.
It might make you go through the commercial part of it first.
Yeah, it's doing that now. So we got 20 seconds left.
Such a great country we're in.
Okay, 5 seconds. Okay, let me go ahead and share screen. Okay, can you all see that?
Yes.
Okay, let me go just I'll make it full screen. Yeah.
Vaccinating America. There is concern that some of the most vulnerable Americans are now being left behind in vaccination efforts. We are talking about people who are unable to leave their homes. More than 1,100 members of the Texas National Guard were recently deployed to help vaccinate people who are either too old or just too ill to get around. Nikki Batiste shows us how a nonprofit home visit nurse program in New Jersey is also trying to reach homebound people who are not yet vaccinated. Good morning to you, Nikki. This sounds really interesting.
Gail, good morning. It's an important story because so far the New Jersey Health Department has not allocated a single vaccine specifically for the homebound. That's why the Visiting Nurse Association here just began a pilot program using vaccines given to them by community health centers. Our cameras followed one of their nurses driving doses door to door.
I'm carrying something that's so valuable, so yeah, I'm going to watch every little thing I do with it.
Packing up vaccines in a temperature-controlled cooler.
Don't jiggle it, don't shake it. It's like liquid gold. You're carrying this. It's, you know, let's hope that this changes the crazy world we're in.
Nurse Peggy Lassoff hits the seaside roads of New Jersey, making a special kind of house call.
What one am I getting?
You're getting a Moderna.
She's administering first doses of COVID-19 vaccines to homebound patients, the elderly, and those suffering from medical conditions who can't get to a vaccine site. We joined Lassoff as she went to them, house by house, for hours. Lassoff is a crucial part of a pilot phase the New Jersey Visiting Nurse Association Health Group has launched, which could become a framework for the nation.
I'm Peggy. They're very appreciative. They've been nervous and scared because they obviously can't get out to get it.
The longtime nurse gave 79-year-old Vincent Newland his first COVID-19 vaccine.
He has heart disease, lung disease, kidney disease, and multiple myeloma. So he has a lot going on.
His daughter, Tyann, told us her dad's dose came after an unexpected phone call.
They called us and said that they were starting a pilot program and if he would be interested in getting it if they did. It was just like, yeah, like, you want to do it now?
They're kind of live in the shadows. They're easy to forget about, but there are parents, there are elders, and they need our help.
Dr. Steve Landers leads the health group. He and his nurses treat 10,000 people in New Jersey on any given day.
The states have not prioritized giving the home health agencies themselves vaccine products. So there's over 12,000 home health agencies across the country, and they serve these millions of homebound people.
I see constituents every day who are in their 70s, 80s, 90s who can't get vaccines.
New Jersey State Senator Vin Gopal says his office has received countless calls from the homebound, so he contacted New Jersey Governor Phil Murphy.
I've raised it directly with him that we need to move away from this open portal system. This needs to be done in a more targeted approach.
What was Governor Murphy's reaction in general? Did he seem to understand?
So Langston, we got to stop sharing now.
Say to state officials who seem to have the power to expedite this process.
So thanks for letting us share, and just a couple of brief comments and updates. So the nurse you saw, Peggy Lassoff, that works in our home health agency, she continues to provide in-home vaccines to homebound people in central New Jersey. She's done first dose for about 100 patients at this point, and she's got 2 more people this week that she's trained, and so we have 2 more people, so we can really ramp that up a little bit further. And we continue. The only model that we have to get vaccines right now for the home health agency population is through, in one community, one of the counties of the many counties we serve, our collaboration with a federally qualified health center, where we've arranged to use, it's a health center that I work in as a medical provider, so we're closely tied to one another. You know, we're able to get vaccine from the FQHC, and we continue to converse with the State Department of Health, with federal officials, and I would urge this group, any messaging that you have, that I think getting the whole homebound population is quite difficult. There are a lot of hidden pockets and people that are unseen, but the active census of our current home-based care agencies would be a great place to start. And there's millions of people that fit that bill. And you know, we've learned from that. We see there are caregivers in the home that want to get vaccinated, and that's a take-home point. Peggy's often being asked by the family members, you know, could you vaccinate me too? And then the other thing that we see is, you know, the 2 doses, it's harder than it would be with 1 dose probably. So we're using Moderna product through the FQHC, but it might be easier if it ended up being, you know, a 1 dose model.
Steve, anything else to share, or should we open it up for discussion?
No, I think I hit on the things that, you know, the big points of what we're working on, and would rather let people have a chance to discuss what they think is important.
Sure. Okay. So as we move into questions and discussion, I'll kick it off by just asking, does anyone here have questions for Steve to kick it off?
RG, it's Megan. If you don't mind, I'd like to ask the first question of Steve. Steve, you mentioned that Peggy has been asked by some caregivers in the home if they can have the vaccine. I'm wondering, what is New Jersey's policy with regard to vaccinating caregivers that are caring for older adults or other family members that may be in the home with them?
Well, on an age base, if we just look at it from the criteria for being eligible for a vaccine right now, the vast majority of the caregivers would be eligible. However, this pilot that we're doing isn't entirely, I know our health commissioner understands what we're doing and has been, you know, watching, but it's not a state-run pilot. It's been something that's been a private collaboration between us and the federally qualified health center. And at this point, we've not on our own taken the liberty to even go further out on a limb than we already are. And so if there is no guidance to home health agencies in our state, and I'm not aware that there's much, other than on February 19th, it was so nice to see the CDC release guidance about home-based handling of vaccine product. That was a very liberating thing. We felt that's actually, I had already done some home vaccinations on my own before that, but it was on February 19th that we kind of let Peggy go loose on the public, because we had additional comfort with the guidance from the CDC. But that really only, it talks about handling of vaccine product. It doesn't guide the states to work with home health agencies. And thus far, I'm unaware of any initiative within our state or you know, from CMS for home health agencies more broadly. We're waiting and hoping to get the call.
Great, thank you.
We have a couple of questions in the chat, so I'll just share from Kyle Allen. And it's a question about the Johnson & Johnson vaccine. Would it be better to prioritize it for the homebound, logistics for transport, time for vaccination, et cetera? And I know you already mentioned this. Is there a con side to that option?
Well, I think it would, again, it's a nurse home visit to a private home. I'm not talking about assisted living or a congregate care setting. It's a very expensive and logistically difficult thing to pull off. And so I think absolutely the 1 dose would be better. And I'm not aware of any cons on that. You know, I've heard commentary about the relative effectiveness of the different vaccines, but none of them have been trialed head to head against one another. And the data on preventing hospitalization and deaths for the Johnson & Johnson vaccine is quite compelling. And I know that we would love to be able to offer it to the 10,000 homebound people under our care. And I believe many of them would be very pleased and grateful to have that life-saving intervention.
So I just want to offer another observation on my part. So at the vaccine clinic that I visited today, yay, first shot, we asked about availability of the Johnson & Johnson vaccine, and we were told that a very limited supply had been delivered to the site and it was gone in one day. So to the extent it's being offered as an option, it's disappearing quickly. So Steve, I don't know if your FQHC has been able to get access to the J&J vaccine, but we have heard that it would be preferable.
The supplies are small. So right now in New Jersey, our Department of Health actually has been working. I told you our agency works also as a public health agency, in addition to being a home health agency. And in our work as a public health agency, we actually have an allocation of Johnson & Johnson vaccine for going to homeless shelters and domestic violence shelters. And so that's been successful, and we've gotten that underway. And again, we're hoping at some point that would be expanded to homebound elders. So right now that we're being thoughtful about not going too far beyond what we were guided to do by the Department of Health, which is focus on homeless shelters and domestic violence shelters and soup kitchens and that type of environment to target the homeless. So if that opens up, if the supply opens up, in the next month or so, that would really help. But we can, as I've shown, we can do this with other vaccine product. And, it's not been clearly prioritized. I would say in my conversation with the state, I'll tell you one thing that I've told them, and I don't know if it's different from what you all will end up thinking, but I tend to think of the problem of the homebound, the completely and mostly homebound, to be a slightly different challenge than seniors that are living in independent living, assisted living, or in public, publicly subsidized apartment buildings. And those are all very important target populations for public health and for health equity as well. But logistically, it would be, in my view, quite a different program. You wouldn't want to send Peggy, who's doing what she's doing, to go up to the 7th floor of a senior high-rise that has 100 people that need vaccines. You would much rather send somebody there in a coordinated program and get lots of people done all at once. And so I think that's another thing that we've tried to recommend, that when we move to these additional populations, we might want to think about people that are homebound in private homes a bit differently than people living in congregate settings, because you could do a more efficient type of program in those places.
Steve, we have a question from Kelly Tarab. Kelly, do you want to just jump on and ask your question?
Sure. I was trying to get myself off mute. Thank you. I'm Kelly. I work with the Department of Health in Wisconsin, and I'm just wondering what issues I might have run into around reimbursement for this type of work.
Well, we have a major challenge in terms of being able to scale what we demonstrated from a reimbursement standpoint, because we know from all the analyses that Medicare has had to do to figure out how much to pay for a home health nurse visit. We know that, roughly speaking, those visits with a registered nurse would cost, over $100, probably closer to $150 when you bake in all the indirect costs as well. So that's an expensive intervention. And even with the new boost in the vaccine administration codes, the vaccine administration codes don't cover those costs. So we're actually doing this. We've been able to raise, over $1 million in private philanthropy in our community to support some of this initial work. And so on vaccinating hard to reach populations. But my recommendation has been since December to CMS that they incorporate payment for home health nurse visits for the purpose of vaccination within a waiver under their usual payment for home health services. So these visits aren't too technically different or more time consuming than a typical nurse visit. They are similar because of the observation period and the pre-work and the documentation, but the amount of labor and effort involved is similar to a nurse needing to go do a wound care visit or assess somebody's cardiopulmonary status after a hospitalization for heart failure. It fits very nicely into what we already know about paying for home health nursing services. It's just the policy's not there.
Great, thank you.
Katie Riley has some insights to share about the J&J vaccine. Go ahead, Katie.
Sure. I represent a home health agency as well. And so some of the challenges that we have are, let me see if I get myself back here. Some of the challenges that we have is just the time that a vaccine will expire before the labor intensive going from house to house to house. And so I just shared that, the J&J has 5 doses in a vial, and that whenever that vial is punctured, it only stores for 2 hours at a temperature less than 77 degrees, between 47 and 77. So even if we had J&J, it wasn't an option for us to be able to use. We're not really getting it. It's being shunted into teachers and also large mass vaccination sites. So rather than not administer to our homebound, we are administering with Pfizer in the city of Chicago and Moderna otherwise. But I echo what you're having to say is that this is something that's highly expensive for our clinicians to do, and foundation dollars, that is fabulous that you've been able to raise some foundation dollars, because there is no reimbursement, as you've just highlighted, Dr. Landers, for this type of resource. So wherever our patients have the ability to get out, like to a doctor's office, or, like if they have the ability to get out to a doctor's office, can we work with them to get them to a vaccination clinic? So it's more efficacious for administration and timing and dollars and everything else. But we estimated that, because we start our pilot program tomorrow, we estimated that every nursing visit fully loaded with the administrative costs, everything else, is about $183 a visit times 2. And then you start looking at, how much that costs. Or if you look at what the reduction in our ability to do our admissions comes out to about $8,000 per day if a nurse can do 3 admissions. So it's trying to balance that loss of revenue, the public health needs, and the cost that it really takes to run a program. So kudos to you for getting the foundation dollars. That's a great way to go.
Well, it's a way to get started. And I think, because we haven't had the challenge of dealing with the refrigeration issue on the J&J vaccine yet for this, we probably, there's some learning that we don't even know, which you're catching on to there in terms of how you would, do the vaccine handling in the home. But the cost for a nurse visit, like you said, that's in line with our calculation. And also, I think when Medicare has looked at what does it cost to provide a home health nurse visit, and they calculate per visit payment rates, that's right in the ballpark of it as well. And, in terms of access to labor, a lot of my colleagues in home health, I've heard a number of people say we might, even if there was a payment model, we might struggle to get staffing on this. I think all the agencies are in a little bit of a different spot in that regard. I think there are a cohort of agencies. I think I will say right now, it's interesting. There's been a bit of softening in the labor market. We're seeing staffing reductions at some of the long-term care facilities and nurses looking for work. So we believe we could staff up if there was a reimbursement model in most of our markets. But if we would have asked me that same question 3 months ago, I would have said, I don't know how we would do it, because it just felt so tight to get staff. But right now it feels a little better in one market, and that might not be the case across the board.
Wow. So we have time for one more question. Kalkidan Kestad has had a hand up for quite a while. Go ahead.
My name is Kalkidan Questad. I am with the Department of Health in Washington. I'm working on the community outreach for the older population, older adult population. And I just had a question in regards to, could we partner up with our National Guard medic teams on the homebound work that you guys are doing? Have you guys explored that kind of idea?
I don't know of that effort, but I think, if you have able-bodied people that are wanting to serve and there's a way to compensate them, maybe, I was impressed by the pharmacy partnership for long-term care where the federal government partnered retail pharmacies with long-term care facilities. I think if you had a way to partner such resources with home health agencies, you might be able to get a lot of people vaccinated that are in need. That sounds very promising.
Hey, Steve?
So, yes.
Can you hear me?
Yes.
Oh, Steve, this is Tom Eads. I just literally hung up the phone with somebody who's our national director of intermediate care technicians. We had this conversation because I was, anyway, about the reserves and National Guard. I will bring that up on Friday. So there are some opportunities the governor can activate. It is a workforce that I'll try to gather some more information and bring that up. Great question.
That's terrific, Tom.
Marvelous segue.
I think if you paired that type of resource with the agencies that already have a known population of homebound, you could start knocking out a lot of these and it would be very beneficial to the public.
That's an exciting thing, Tom, to hear. If we can go to the last slide, our time is always quickly up in these calls. So I want to thank you all for a rich conversation today. We will be sharing the slides and the recording after the event. We will continue for the next few weeks. TIFA will be hosting these 30-minute huddle calls on Wednesdays and Fridays on topics related to enhancing access to the COVID vaccine for people who need them administered at home. And as Tom said, our next call is on Friday, the 19th of March, and he will be our featured speaker from the Department of Veterans Affairs. We hope you will join us and spread the word to your colleagues as well. I'll paste the links one more time into the chat so that you can share them with folks. And we want to thank everybody very much for all of the work that you are all doing out there. Thank you all so much and have a great rest of your day.
Great. Thank you, Steve. Appreciate it.
Thank you, Steve.
Thank you.
Thanks, everyone.